Good evening, everyone, and Happy New Year. My name is Leah Ruttman, and I'm the Healthcare and Liberty Counsel at the ACLU of Washington. My pronouns are she, her. I'm speaking from the traditional homelands of the First People of Seattle, the Coast Salish peoples, who have stewarded this land since time immemorial. Our office downtown sits on the unceded territory of the Duwamish peoples. We must always remember the role our country played in stripping them of their lands, culture, and language, and recognize the ways in which we perpetuate colonization today. Land acknowledgements like this are just the beginning. We recognize that there is so much work we need to do to make this country truly fair and just. I encourage you to learn about the land you are on. See the link in the chat to find out more. I also want to share a powerful animation on the scale and severity of land loss. Check out the link that you can also find in the chat. So before we get started, I want to thank the many organizations that are co-sponsoring tonight's event. We have a wonderful group of organizations, including the American Association of University Women of Washington, the Alliance for a Healthy Washington, Cedar River Clinics, Compassion and Choices, Economic Opportunity Institute, End of Life Washington, League of Women Voters Washington, Legal Voice, National Women's Political Caucus of Washington, Northwest Abortion Access Fund, Northwest Health Law Advocates, Planned Parenthood Alliance Advocates, Planned Parenthood of Greater Washington and Idaho, Pro-Choice Washington, Rainbow Center, SEIU 1199 Northwest, and Washington State Nurses Association. I know that sounded like a mouthful, but it's because we are so lucky to have all these amazing organizations co-sponsoring this event today. Before we get started, I have a few housekeeping things. Our flights and rides are typically hosted in breweries and event spaces around the state. Most often the gathering space previously was KEXP 90.3 FM in Seattle. KEXP has been a really important partner through the years. Even though we aren't together in person, we have flights to go with your rights. So stop by Stoop Brewing, $5 off a glass flight or growler at either the Ballard or Kenmore locations from January 5th to 7th until your tab runs out. Or visit the doctor's office in Seattle's Capitol Hill neighborhood for a discounted specialty cocktail, ACLU Manhattan, from January 5th to 9th while supplies last. Details are in the chat box and also on our website. Everyone in attendance tonight has also been entered in our Supreme Swag giveaway. Our prize package includes swag by Indigenous artist Emma Noyes and a set of KEXP and ACLU koozies to keep your hands warm and your drink cold. You cannot get any of this anywhere else. We'll draw names after the event and notify 3 lucky winners by email in the coming week. So whether you're here tonight because you support the Keep Our Care Act, because you want to learn more about the Keep Our Care Act, or because you want free booze, we are so glad you have joined us, and we are very excited for the distinguished panel we have tonight. As I think you all know, we are here tonight to talk about healthcare. Across the country's mergers and acquisitions between healthcare entities have been occurring at a prolific rate. The healthcare market is increasingly consolidated, and it is predicted that the financial effects of the COVID-19 pandemic will drive more health entity consolidations. These mergers and acquisitions are deeply concerning because a wealth of research and firsthand experience shows that health entity consolidations negatively impact cost, quality, and access to necessary healthcare services, including reproductive, end-of-life, and gender-affirming care. Studies show that consolidations can increase hospital prices by over 20%, and that provider group prices also increase. One study found that physicians in the most concentrated markets charge fees that were 14% to 20% higher than the fees charged in the least concentrated markets. I believe tonight you'll hear some of how this has impacted Washington State specifically. Mergers and acquisitions can also exacerbate systemic inequities. Lack of market competition, combined with private health systems' efforts to increase revenues by attracting more patients with private insurance, has been found to lead to worsening healthcare access and outcomes for Medicaid patients who are disproportionately people of color. Again, I think you will hear stories tonight where Washington State Consolidations has led to a focus on attracting patients with private insurance. Sadly, there is no evidence that quality of care improves with consolidations. Indeed, Washington State data shows that our large health systems rank poorly in quality measures, with patient satisfaction scores that are lower than independent hospitals. Again, as you will hear tonight, we have also seen barriers placed on accessing reproductive and end-of-life care when these mergers occur. working conditions have also been known to suffer. Yet with all these issues raised from consolidations, our state has almost no oversight. Essentially, these large health systems dictate whether you, me, and everyone else in our state has access to affordable quality care. I am so excited to introduce our panelists tonight who can tell us what's been happening on the ground. And I'm also excited to introduce you all to the Keep Our Care Act. The Keep Our Care Act would ensure that there is oversight of these consolidations. It would ensure that when health entities merge, are acquired, or contract, they would improve rather harm access to affordable quality care within a community. The bill includes a prohibition on health entity consolidations that diminish access to affordable quality care. The Attorney General would have oversight, compliance, and enforcement power to ensure health entity consolidations do not negatively impact access to healthcare services. A health equity assessment would be required so that health entity consolidations address the needs of marginalized communities. And community input, so input from you and I, would be part of the process through public notification of proposed consolidations and the opportunity for public hearings and comment. I encourage you all to go to a link in the chat where you can find information about the Keep Our Care Act, as well as actions you can take to support this effort, including signing a petition, sending an email to a friend and family, as well as social media messages that you can post. I'll be reminding you about this link again before the end of the event. Encourage you to go there. So without further ado, I'd love to introduce our distinguished panelists. The first panelist is Judy Mckinney, MSW, she, her pronouns. Judy has been End of Life Washington's executive director since May 2020. Judy has a passion for end-of-life sovereignty, well-being, equity, and public health. Judy has a master's and bachelor's in social work with a focus on community administration and programs. She has worked with younger and older folks in Arizona, Washington, and North Carolina. Her experiences as a nonprofit leader, equity and inclusion trainer, life coach, advocate, and event organizer has equipped her well for her current role. Judy's idea of a life well spent includes partnering with a broad spectrum of engaged and opinionated volunteers, boards of directors, staff donors, and community members to bring bold visions to life. I'd next like to introduce you all to Susan Young. Susan Young has been involved in activism to varying degrees since she was in high school. Her career in the field of education has included being a classroom teacher, a site administrator, and a professional development provider. She has published more than 12 books and is an internationally known speaker. Her interest in healthcare activism began while residing on Lopez Island, where access to the full spectrum of services was limited, not just geographically, but also by restrictions imposed on island providers. Upon her relocation to Bremerton several years ago, Susan intentionally chose Virginia Mason to be her primary healthcare provider because that system offered affordable, comprehensive, equitable healthcare. Thanks to Virginia Mason's recent merger with CHI Franciscan, that is no longer the case. The situation spurred Susan to become an advocate for all Washingtonians to have ready access to affordable, comprehensive, high-quality healthcare. And we are so glad to have you as an advocate, Susan. I'd next like to introduce you to Courtney Norman, also she, her pronouns. She serves as the Washington State Director for Planned Parenthood Alliance Advocates. As the state director, Courtney directs field communications policy and electoral efforts to promote, protect, and advance access to sexual health, education, and reproductive rights in Washington. Courtney has successfully led Planned Parenthood's efforts to pass proactive legislation, such as the Reproductive Parity Act, 12 months of birth control, confidentiality and insurance communication, and Washington's new comprehensive sex education law, while defending against federal attacks on the Affordable Care Act and Planned Parenthood. She served as the campaign co-manager of the victorious 2020 ballot measures campaign to approve Referendum 90 and protect sex education. Courtney serves on the board of Win-Win Action and on the steering committee of Our Votes Count, a coalition of progressive organizations working to engage new and low propensity voters in elections to secure the margin of victory in state legislative races. Thank you so much to all of you for joining us today, and we will get started with our questions. As many of you in the audience may know, in Washington state, terminally ill patients have the right to access medical aid in dying. Access to medical aid in dying, though, does have restrictions. There are numerous barriers, including the need to have 2 doctors assist with the process and go through waiting periods. However, one of the largest barriers is that health systems are allowed to prohibit doctors from participating in medical aid in dying, even if they want to. They can't do it on their premises. We see this happen all the time in Washington state, and I'm so glad Judy is here to talk about this today. Judy, could you tell us a little bit about how end-of-life care and medical aid in dying specifically have been impacted by health entity mergers and acquisitions in Washington state?
Sure. Leah, thanks for asking that question, and it's great to be here this evening. And when I think about talking about the impact, I think it's important to go back a bit and look at some of the context that we're operating in. So Washington, since the late 80s, has been a leader in end-of-life choices and care. This really came out of the AIDS epidemic, and many of the supporters and the advocates from that era are still active, advocating for end-of-life choices today. A lot of people don't realize that Washington was the first state to try to advance medical aid in dying laws in the 90s. And as you say, once the Death with Dignity Act was passed in 2008, a part of the act is that providers were allowed to prohibit provider participation under the act. And so when I think about what's the impact of the mergers, particularly over the last 10 plus years, I think it's important to look at, on one hand, Washington is this leader. We're still a leader in valuing end-of-life care, choice, body autonomy. And yet, on the other hand, we're operating with one of the most medically restrictive cares of all states outside of Alaska. Like that contrast, I just think really brings this issue home. And so whereas, patient Washingtonians value patient care that's guided by, body autonomy and choice, that's being determined more and more by the ethics of the Catholic Church. Local medical care is becoming less and less reflective of the values of our communities, as it should be. And so these mergers, really creating, just exasperating what is already an uphill battle for embracing aid in dying as the legal, basic medical care option that it is. And as you mentioned, there's lots of protections and things that someone who's terminally ill need to navigate. And then the mergers are exasperating what an individual has to go through to access care, creating inconsistent care, myths and misinformation, even among supportive institutions. Delays, we estimate that between 20 or 30% of the individuals who start the medical aid in dying process are not able to finish. And there are delays that are caused by these mergers. Last year, we enrolled 532 clients. This year, we experienced overwhelming increase in number of clients, up 36% to 726 clients. And of our clients that are coming in, we estimate that 7 out of every 10 need help identifying those 1 to 2 supportive physicians so that they can access aid in dying care. And when we look at why do those people need help finding physicians, we see that the vast majority of those individuals, their primary care providers, are working in restricted institutions. And so right now, we are concerned on one hand about our ability to respond to this growing need, but we can't help but wonder about all those individuals who didn't know that death with dignity or end-of-life Washington was even an option in the first place. It's a significant impact.
Thank you so much for sharing that, Judy, and for the amazing work that End-of-Life Washington does. Susan, turning to you, I'm so glad you're here speaking with us tonight as a community member from Kitsap County, because I feel that some of the health system consolidations in our state are quite well known. The Swedish Providence affiliation is a really good example of that, where it was blasted all over the media, as it should be. In 2017, there was that Seattle investigation that was highly publicized with the Seattle Times, where it was found that after the affiliation, Cherry Hill's neuroscience program adopted sort of high patient volume practice that increased revenue but placed patient care in jeopardy. And it's so important that all this be known, but I feel like it's not as often discussed what's been going on in Kitsap County. And Kitsap County has been hit so hard by these consolidations. So could you tell us a little bit, as a community member and an advocate, some of the consolidations that have occurred in Kitsap County and what that has looked like on the ground? Do patients have a choice on where they can access care?
Thanks for asking that question, Leah. It really is important to educate the public about what's happening. I had an opportunity this past summer to do some door knocking and talk with folks right in Kitsap County about our current healthcare situation, and many of them did not understand the impact fully that the mergers have had on us. And we are one actually of 10 counties in the state of Washington where patients do not have choices when it comes to hospitalization. The only hospitals available to these people are hospitals that involve mergers with organizations that heavily restrict certain aspects of patient care. There are two mergers that I want to talk about tonight that directly impact Kitsap County. The first one took place, it began in 2013, it was formalized in 2014, and it was a merger between CHI Franciscan and Harrison Medical Center. And at that time, there were lots of concerns when the public finally found out what was going on about this merger happening. And a lot of the concerns that were expressed revolved around 3 points. One, which seems kind of fluffy, is they did not want the name of the hospital changed, but that was because it was named after two really important people in the community. The second concern was about reproductive healthcare. And the final concern was about end-of-life healthcare. And all kinds of assurances were made at that point in time to the community that nothing would change, that agreements were going to be made in perpetuity that would enable the full spectrum of reproductive and end-of-life services to be offered to residents of Kitsap County. And sadly, that's no longer the case. And the reason for that is because in 2018, a document called the Ethical and Religious Directives was revised. And at that point in time, all of the loopholes that had been in that document, which allowed for agreements to be arrived at that would allow hospitals to continue to offer services, those loopholes were closed. And so it was no longer possible to do that. Then in 2021, the last promise was broken when the name of Harrison Medical Center was changed to St. Michael's. There was a second merger then that was finalized early in 2021, and that was a merger between CHI and Virginia Mason. You mentioned in my introduction that I had gone to Virginia Mason. Many residents of Kitsap County did that because unless you were in dire straits, it's possible to walk on the ferry, get to their facilities, and get health care that's more comprehensive. So that was what many of us did until the merger was approved between Virginia Mason and CHI Franciscan early in 2021. So now people lost not only that option of going to Seattle, but also there had been a Virginia Mason clinic on Bainbridge Island, which also was not easy for everybody to get to, but it was possible. And that clinic now is also not an option. But in addition to these two mergers, which both created horizontal monopolies, and most people are familiar with that. Horizontal monopolies are those that are the traditional, you can't get the services, employment, that kind of thing. What also is happening is vertical monopolies, and vertical monopolies take place when a hospital system comes into an area and then buys up the private physician practices. They buy up all the other services, labs, day surgeries, anything you can think of, including hospice. In Kitsap County right now, 69% of all hospice care is provided by CHI Franciscan, which means, as Judy had mentioned, people aren't even told that death with dignity is an option for them. So these are just some of the issues that we're seeing in Kitsap County.
Thank you so much, Susan, and thank you for your advocacy on this issue. I'm going to turn it to Courtney. Courtney, thanks for being here today. Access to abortion is always an important issue, but is really in the limelight right now for a variety of reasons. Can you talk a little bit about the impact of consolidations in Washington state on access to abortion, and how this issue is also sort of an equity issue?
Absolutely. Thank you so much for having me, and it's always a pleasure to work with you, Leah. So reproductive health care is basic core health care that nearly all people need and will utilize at some point in their life. And that includes contraception, vasectomy, fertility treatments, hormone treatments, tubal ligation, and of course, abortion care. All of this is deeply personal, and it's care that people need to be able to receive, knowing that they're not being judged or stigmatized against, and that they're not having information withheld from them. And any health entity that's going to purport to be the core provider in their community, providing basic health care to people, ought to be able to meet that bar. Just as with end-of-life care, reproductive health care has got to be essential. So when it comes to abortion care in Washington, these mergers and consolidations, all of these healthcare entities have absolutely had an impact in restricting the network and access to abortion care that people can find. When in 2012, when Swedish merged with Providence, as we've heard mentioned, they did start restricting and they stopped providing abortion care. They also stopped providing emergency services for anyone experiencing a miscarriage. And then in 2019, a similar kind of takeover when Peace Health expanded in Skagit, San Juan, and Whatcom counties. You can imagine the barriers that folks face when it comes to transportation in the San Juans. It truly becomes tremendous, especially when you're thinking of a time-sensitive healthcare procedure that you're trying to seek. It doesn't just mean, can I go to my local place? It means, okay, so now I can't. I need to find transportation. I may need to take time off work. Can I afford the transportation? Do I have childcare? There are many different considerations that people have to make when they're preparing to get abortion care. And most recently, when Virginia Mason merged with CHI just in 2020, they were very clear with the public about the changes that were about to take place. We as advocates did our very best to raise our concerns and to talk about the real harm that would be caused if Virginia Mason were to stop providing abortion care, which they had indicated they would be doing. We had meetings with the CEO, we sent open letters, we alerted the media, and the community did push back. But at the end of the day, there was nothing that could be done to actually stop the restriction of care from going through. And that's why the Keep Our Care Act is so desperately needed before more mergers and restrictions are allowed to take place. I wanted to share a couple of other things that have happened when it comes to reproductive health care and what we've been able to do in Washington. In Whatcom County, when Peace Health took over, the Mount Baker Planned Parenthood, which serves Bellingham, Mount Vernon, and San Juan, they had been contracting with Peace Health for all of its lab tests, but under a change, they suddenly were being told that those lab services were going to be canceled. And it was clearly targeted because Planned Parenthood is an abortion provider. After some outcry, they backed off of that, but this is the kind of thing that happens when when we end up having ideology start to get engaged in the healthcare process. It's not just straight to providers, or to patients, but also implicates providers in the whole network across our state. We know that from research that many facilities, many healthcare entities don't explicitly inform patients about the restrictions that they have. And physicians, particularly OBGYNs, often struggle to arrange workarounds for patients to get the care that they need. Again, not just abortion, but things like birth control devices. Fortunately, thanks to our outstanding state legislature, we have a couple of new pieces of legislation that have recently passed. In 2019, a new law that requires at least a form and some official declaration of what services an entity does and does not provide. And in 2020, a prohibition so that healthcare entities could no longer gag providers from being able to talk openly with patients about their medical options that would be forbidden within that health system. So at least doctors can tell people what their options are, even if they couldn't provide that care under that employer. And if you think about the Trump administration and the Title 10 gag rule, you can see how important it is that all providers need the right to be honest with patients about their options. And it certainly is a healthcare equity problem. I know I'm probably running over in time, so I'll try to speed up. Abortion access doesn't look the same for everyone in the United States. And it's because of those kinds of barriers that I described before: income, transportation, insurance coverage, can you find childcare, and more. And the COVID-19 pandemic has just increased those inequities. And so abortion access coincides with people's socioeconomic resources. And health entity restrictions are often disproportionately impacting people who are already systemically excluded: Black Americans, people of color, low-income folks, the LGBTQ+ community, and young people. And when you're denied access to abortion, research shows you're also having greater odds of living below the federal poverty level. So these entities that purport to care so deeply about people's financial well-being and getting out of poverty really need to do better. And we're hoping that the Keep Our Care Act can help us get some better oversight of their processes.
Thank you so much, Courtney. That's so important information for all of us to hear. Judy, I'm going to turn back to you for a minute. I know end-of-life care, thank you for this, deals with the reality of patients accessing or not accessing medical aid in dying. From your experiences and your organization's experiences, can you tell us about some of the patients and families you have worked with who have sought end-of-life care and what it looks like when patients aren't able to access medical aid in dying?
Yeah, I used some of the information just to kind of paint the context in the previous question, but I want to share a couple stories with you. The stories that pull at my heartstrings the most are those who have been aware of and advocated for death with dignity for years and from the beginning. Like George, for example, is an individual who advocated and was one of our volunteers in helping to pass the Death with Dignity Act, and he voted for the act. And George is someone who lived with peace, knowing that if he became seriously ill, he would be able to access death with dignity if he were to suffer. And yet George, when he was 80, found himself in the emergency room of a restricted institution and discovered that he had a prognosis of about 4 weeks to live. And in that moment, George is, exclaiming, "I want the life-ending medication prescribed to me so that I can use it when I get home before my body completely shuts down." He had the support of his family, his wife, But instead of his wish to have one final evening with his loved ones where he could say goodbye and laugh and smile and then go out on his own terms, celebrating the life he lived, George spent his final days dying badly for no reason other than, an emergency room, a medical institution wasn't able to provide him the care that he was seeking. George is one of many like that. And then there's Susan, who's very recent this summer, found out that she had lung cancer. And when the first things she thought of when she heard her diagnosis is, thank goodness I live in a death with dignity state. She lived alone and didn't want to spend her final days hooked up to a hospital and machines. She didn't want to add stress to friends and loved ones. She found immediate comfort knowing that she would be able to die with autonomy on her own terms. And then she learned that her primary care physician and all the doctors in her healthcare establishment were associated with restricted institution that did not support death with dignity. And so that meant that Susan had to, she couldn't count on her doctor, PCP, when she really needed them. Like Susan speaks for so many people, so many of our clients who said, just when I need my doctor the most, I was forced to find a new one if I wanted to have agency in my death. It seemed illogical in a state where medical aid in dying is legal. Those are two stories of many that reflect many. I think another piece of it, and we're reflecting the conversations around equity, is the mergers impact our desires in organization to increase our racial and geographic equity access. Presently, so 98% of the people in Washington State who are accessing aid in dying are white, and 96% live west of the Cascades. We look at that and are committed to making that change, and these mergers make it challenging on top of challenging. So those are just three ways that reflect many stories behind those, the impact of these mergers.
Thank you so much, Judy. It's so important to hear sort of what's occurring on the ground.
Yeah.
And for the work you are doing. Susan, I'm going to turn it over to you now. Thank you for sharing and giving examples of some of the consolidations that have occurred in Kitsap County. Could you speak a little to any changes you've seen when it comes to cost or quality of care in Kitsap since these consolidations have occurred? I remember that there was an Attorney General lawsuit filed related to CHI Franciscan sort of gobbling up not just the hospitals, but the provider groups and being sued for the increased prices. And it was an antitrust suit. So would love to hear more from you about what you've seen on the ground.
Absolutely. I'll talk first about affordability and then about access to comprehensive care. In terms of affordability, I was recently working on some testimony related to a certificate of need application that caused me to look into what the cost is when patients are discharged from hospitals and how do they rank in terms of overall cost to people. In 2019, of the top 10 most expensive hospitals in the state of Washington, 8 of them were owned by CHI Franciscan, including the hospital in Kitsap County, which gives you a bit of an indication of where we are at this point in time. Additionally, in 2017, a lawsuit was filed because CHI Franciscan was not providing the charity care that as a nonprofit they are required to provide. And the system is still, the suit was not settled until 2019. the system is still under supervision by Bob Ferguson's office until 2024. They're going to be monitored to ensure that patients are getting the charity care that they are entitled to. And that it came out then that employees were actually told that they were not, even when somebody obviously would have been qualified, they were not to tell the patients about this care. In addition to that, there is the antitrust lawsuit that you mentioned that also was settled in 2019. And the concerns that came out there, it actually involved two different healthcare providers, but the concerns that came out there included higher prices, increased wait times, scheduling snafus, fewer services, and fewer locations. Because another thing that mergers do is they talk about duplicative services. So for example, St. Michael no longer has a dermatology department. And I am assuming that's because through Virginia Mason facilities, they have dermatology offered in Seattle, but what was being offered by St. Michael in Kitsap County is no longer available to patients. They also are scaling back on many end-of-life reproductive services. They are not making referrals to providers outside the system, even though legally they're supposed to do that. And there are a lot of concerns being expressed now by residents of Kitsap County about unnecessary procedures being done in those vertical monopolies where patients are referred to other providers that are owned by CHI Franciscan. Lots of stories about extra procedures being done that were expensive and really did nothing to help the patient, but did help the bottom line. And particularly end-of-life patients. In addition to that, there is really low morale amongst staff members, people who work in the facilities. There was a lawsuit that was filed by a nurse that ended up being a class action suit because healthcare workers were not being paid for work that they were expected to do during their breaks, their lunchtime, and before and after their shifts. And CHI lost that suit. There was also an issue during the COVID outbreak that took place in 2020 in St. Michael's Hospital. I believe it was the largest outbreak in a hospital in the state. It was certainly at the time, and I think it still is, but PPE was not being provided, protocols were not in place, the Department of Health was brought in, and this kind of thing is all pretty unnerving. Then finally, in terms of the LGBTQ plus community, in 2020, a woman who is an employee of St. Michael brought a lawsuit because her child, who is transgender, was being refused services by Blue Cross Blue Shield of Illinois, the insurer for employees of the hospital, because the hospital directed the insurer to deny coverage for the treatment that this teenager had been receiving. So these are just some of the examples of what's been happening.
Thank you so much for sharing that, Susan. And I'm sorry that Kitsap County is dealing with all of this. Courtney, turning to you, the constitutional right to abortion is anything but guaranteed right now, with the Supreme Court posed to make a decision that may overturn in actuality or in effect Roe versus Wade, and pregnant people in Texas already experiencing what a right without abortion looks like. I know Washington State has a fundamental right to abortion enshrined in our laws. So even if Roe versus Wade was overturned, we would still have that right. Mm-hmm. But what is the role for Washington State, given what's going on in the country related to abortion, and how do consolidations play into that?
You're right, Leah. Roe is absolutely in peril, and we have seen studies coming out showing that if the U.S. Supreme Court weakens or overturns Roe v. Wade, then 26 states are either certain or likely to ban abortion. And as you said, Washington will still protect the right to choose, even if or if or when other states take it away. But that means we have to prepare for an increase in women of reproductive age who may drive to Washington for their abortion care. And it really will depend on the type of ban the Supreme Court upholds, how big of an influx of patients we can expect. But the Guttmacher Institute estimates, depending on the type of ban, if it's 20-week, 15-week, or total ban, it would be a 22%, 102%, or 385% increase in patients. And most will be coming from Idaho, Montana, Oregon, or Nevada. And that, I think it's really staggering. It's really, even though we work for reproductive rights every day, it's really hard to wrap our heads around. And on the operational side, we're working very hard to prepare for that influx. But the reality is that we need every provider who is available, who is willing to provide abortion care, to be able to do that. And they need their employer to get out of the way and to make sure that that care is available. So when health systems merge, we need to make sure that providers don't lose their right to provide that care under a new employer. And we need to make sure that that network of providers is as strong as possible, especially in rural areas. I want to be clear, the Keep Our Care Act does not force any health entity or any healthcare provider to provide abortion care. But what it would do is make sure that there's public oversight to make sure that if a merger is happening, if an entity is consolidating, that they are not going to be lessening the care that is available today, that they're not going to be blocking providers. And so that's a big impact that we're preparing for, and it means Washington's role is really urgent. Other states, my friends in other states are really facing some serious uphill battles, and it's incumbent upon us to be the strongest allies we can be by making sure Washington is ready and available to provide care to everyone who comes to us from these other states where they're losing their right. I also just want to share, people often assume that there's simply just somewhere else that folks could go if they get turned away from the care that they're seeking. Like, well, you're Planned Parenthood, won't you just provide all of the abortion care people need? The reality is that that we are not able to provide all of the care and meet all of the need that is out there or that's coming to us. And just last year, we were forced to close health centers in Kent, Shelton, and First Hill, which used to be the facility that was funded by the Providence and Swedish merger. And it's because of unsustainable funding rates and the COVID pandemic exacerbating. Unlike a big hospital system like Providence, Planned Parenthood entities cannot apply for federal funding for COVID relief and then invest it in the stock market. We are blocked from that because of the Hyde Amendment that blocks federal funding for abortion care. So again, we need a network that's stronger because communities deserve equitable, timely, affordable care. And every individual has that right, no matter where they live.
Thank you so much, Courtney. And I'll just have a final question for each of you, and then we will go on and hopefully have time to answer some of the audience's questions. Thank you for all bearing with us. So, Judy, I just wanted to ask you, I know End of Life Washington supports the Keep Our Care Act. Why is it such an important bill to you? And are there any other legislative efforts that we should be aware of this session?
Sure, thank you. But just real quickly, we are definitely supportive of Keep Our Care Act, really looking for that oversight from the Attorney General level of oversight that our state needs. I think there's that also piece around the assessment. We've talked about equity a lot tonight, and we can't underestimate the importance of that. So really having like a statewide assessment of the equity impacts is really, really essential. I think it all comes back to really Washington has to join other states in protecting communities' access to care. It really is that oversight is about supporting Washington to be Washington. and who we are and what is important to us, which is around patient autonomy, body autonomy, and choice. So thank you. Oh, yes. And I have to talk about HB 1141, which is the Increasing Access to Death with Dignity Act. We tried to get that through the legislature last year, and we were not successful. We're coming at it again. I think these two bills together really go to support patient choice and autonomy. And HB 1141 decreases the waiting period from 15 days to 72 hours, expands prescribing and consulting roles to include physician assistants and nurse practitioners. This is essential, particularly in rural areas and for communities of color, or many times who people are accessing. That's really essential. And then just allowing medications to be mailed, couriered, or for a pickup. And so HB 1141 seems like a fabulous partner bill with Keep Our Care Act.
Thank you so much, Judy. And moving on to you, Susan. So thank you for everything you've shared tonight. And I think a running theme from all of what we've heard is that, you know, those most marginalized, those who are uninsured or underinsured, sometimes bear the brunt of these consolidations in ways that others just can't even imagine. I know that one thing that has happened in Kitsap County is, or I believe that the Bremerton Healthcare Center has closed and has been moved to Silverdale, and that happened post-consolidation. Could you just briefly sort of let us know about that and the community's reaction?
Sure. Yeah. The original agreement that was hammered out in 2014 said that 85 hospital beds and the emergency department would continue to exist in Bremerton. And the reason for that is because Bremerton is the largest city in Kitsap County, but it's also a higher poverty area than many of the other cities in the county. And folks who live there often don't have any transportation aside from public buses or other agencies that might provide transportation for them. So it really makes no sense at all to not have at least some hospital beds in the city where there's the greatest amount of need. But in 2017, despite the agreement that had been made, CHI Franciscan went to the Department of Health and applied for permission to change their certificate of need to move those 85 hospital beds to Silverdale. And despite the fact that there was an enormous outcry in the community against doing that, it was approved. The promise was made that the emergency department at Harrison would continue to be in place until an urgent care and a primary care clinic were built in 2021. As you may probably guess, just like all the other promises that were made, that promise also has been broken. In July of 2021, with less than 24-hour notice, the emergency department was closed. So we have no emergency, no urgent care services at this point in time in Bremerton at all. So the closest option is Silverdale, which is 20 to 25 minutes or more away, depending upon traffic. And if you have an accident on the highway or anything, then no telling how long it's going to take for somebody to get transported. So this is a huge issue. And interestingly, I was just looking at reports from CHI on their certificate of need application, the quarterly progress reports that are required. And there is mention of the emergency department, but not mention that it was closed. So officially, apparently it's still open.
That is very strange. And thank you for sharing that. And Courtney, I think we'll close out the questions with you right now. I know Planned Parenthood is also supportive of the Keep Our Care Act. And could you tell us a little bit about why, and if there's any other legislation you'd like to point the group towards?
Yeah, absolutely. We're just very proud to support the Keep Our Care Act, and excited about the legislators who are sponsoring it. Today was an exciting day for our coalition because we got our bill numbers. So on the Senate side, under Emily Randall, the bill number is 5688, and on the House side, under Representative Tara Simmons, it's HB 1809. No coincidence that they are out on the peninsula. We've been hearing a lot about Kitsap, so I'm really glad that we have some local representation behind the legislation. And the legislation that Planned Parenthood is also excited to support this session is the Affirm Washington Abortion Act. And it would clarify existing law to ensure that advanced practice clinicians, such as physician's assistants and advanced registered nurse practitioners, can provide abortion care. That's already within their scope of practice, and it has been in effect for some time because we have two great attorney general's opinions who have, which have both determined that this care could be provided under the law, but now is the time to move that into statute before we see this further dismantling of abortion rights across the nation. And so because of the real need and the real concern that we have watching the national landscape shift so dramatically against abortion access, we know that the Keep Our Care Act and the Affirm Washington Abortion Act are both incredibly important to get done in this current session. And we're just proud to be partners along with all of you to do that this year.
Thank you so much, Courtney, and thank you to all of you wonderful panelists for being here tonight. I'm going to turn quickly to some of the Q&A questions and see if any of them would be good to address in the couple minutes we have left. One thing I do want to address is there's one question about whether if the Keep Our Care Act passes, will it be retroactive to require healthcare organizations that have already merged to abide by provisions of the Act. I wish it were so. Unfortunately, the Keep Our Care Act is only applicable to mergers that will occur in the future, not ones that have previously occurred. It's why it's been so important to pass the laws that Courtney was talking about to ensure that patients know where they can access care, get the information they need when they can, because at this point in time, this bill would only address future mergers. Another question that I see asked is there evidence that the Vmchi merger has affected care for transgender patients? So I personally don't have information as to whether it has. I know Virginia Mason said on multiple occasions that it would not impact access to care. One thing that I think is important to note is I don't think anyone on our panel today has firsthand information about the impact of consolidations on gender-affirming care. However, this is a significant issue that we've seen. You can see in our one-pager, Marsha Botzer has a quote discussing how the community is aware that consolidations can restrict and have really negative impacts and create barriers when it comes to gender affirming care and how harmful that is to the community. So I want to make sure that that was discussed and raised during this conversation. There were some other questions that were put out here regarding religious organizations. And I just want to clarify for purposes of this bill, the Keep Our Care Act would apply to all health systems and health entities because we want all of them to provide the full range of care and to provide affordable, equitable, quality care. And different health systems in our state are better or worse at providing different aspects of this. But really, there needs to be a market improvement overall and to ensure that's oversight. So it applies to all. So This bill in and of itself just isn't related to any specific religious entity or other entity, and would hopefully ensure that all healthcare entities provide better care and continue to provide care after a consolidation. I hope that helps provide answers to that question. And I see a question of what can we do to support the Keep Our Care Act, and should we ask our legislatures to support the bill? So it's almost like that question was planted because we love it. I'll speak to that, and then maybe some of our panelists may also want to say something. I can say that go to that toolkit, which we will put in the chat again. You can sign our petition. You can post on social media. You can email your friends or family about this. Soon, I believe we will also have information on there about best ways to speak to your lawmaker. I know there were questions put forward about why are we not talking about this in the news? Go for it. Talk about this in the news. Get it out there. So I'm going to pass it on to our panelists to see if they have anything they'd like to add.
That's, my favorite question. How can I help? What can I do? I just want to tell folks that sharing your story and sharing about your values and your vision for Washington is by far the most important thing you can do. Reach out to your legislators and let them know about the impact that you've experienced or that you fear would be experienced if we aren't able to pass the legislation. Also, I guarantee there's a field organizer near you who would love to hear from you. And so I'm sure there are lots of links that are happening in the chat right now, but rest assured, if you tell us you want to volunteer, we will follow up.
And if it's okay, I'll put my email address in the chat. I do work with a grassroots group in the Puget Sound area, and we are going to be closely monitoring the Keep Our Care Act and other related legislation and posting in weekly newsletters actions that people can take and help them out with all kinds of information. So is that okay, Leah?
That would be great. Yes, every way people can get involved, we encourage. I think we are almost at time, so I don't think we'll be able to answer any more questions, but I want to thank all of you for coming tonight. I want to thank our wonderful, wonderful panelists for being here. And thank you for tuning in to our Flights and Rights in general. Please do visit Stoop Brewing or the doctor's office if you're able to do so. You all deserve a drink. And good night. Thank you all.
Thanks so much.
Thank you.
Thank you.
Take care.